Hi everyone. So in this video we're going to be taking a look at the disorders of the adrenal cortex. We're also going to be taking a look at the stress response. And when we get into the stress response, we're going to be taking a little bit more look, or not a little bit more, but we're going to talk about the functions of two other hormones that we haven't talked about yet. We mentioned epinephrine and norepinephrine. So we're going to be taking a look at what their role is whenever they're secreted from the adrenal medulla. All right, so let's first take a look at the disorder called Cushing syndrome. And over here they give you pictures of a woman that before she has Cushing syndrome and then after Cushing syndrome. And it says that it's a result from excessive glucocorticoid secretion from the Cushing syndrome. So anytime that an individual is exposed to an excessive amount of glucocorticoid hormones, then they can develop Cushing syndrome. So remember in the last video I said that doctors typically don't want you to take corticosteroids for a long period of time. Sometimes it has to be done and you can't help it. But if you can help it, then you don't want to take it for a long period of time, because what happens is that Cushing syndrome can occur because of that. So some cases it's when just the body naturally produces too much of the hormone. So there's a couple of ways that this can occur. What happens is remember, one of the things with high doses of cortisol that we mentioned was retaining sodium in water. So that can definitely occur, kind of giving a little bit more of an appearance of having more water retention. But it can also come from obesity, one of the other signs or symptoms of Cushing syndrome is obesity. And it's mainly because the body's producing or putting out all of these nutrients in the bloodstream. And if the body doesn't use those for cellular respiration, then it will typically go in and store it as fat in the body. So that's why that can occur. And with Cushing's, it will typically, the adipose tissue is going to kind of be stored a little bit more in the back, and it's called a buffalo hump. So if an individual has a little bit of like a hump right here, I guess kind of I don't know, in between their shoulder blades a little bit, or right in that area, then that's called a buffalo hump, and that's one of the kind of telltale signs of Cushing syndrome. And also something called moon face. You can kind of see how the shape of her face changed a little bit as well. It can cause extra hair growth to occur, if it is a female, problems with menstrual cycles, and kidney stones. So now let's take a look at Addison's disease. So Addison's disease can result from a lot of different things as well. Maybe the adrenal glands were not formed correctly from birth. It could be from an autoimmune disorder. So those are just a couple of things that can cause Addison's. But it is a form of adrenal insufficiency. So the adrenal gland is not producing the glucocorticoids that it needs to. And again, it can also be from a lack of ACTH, or even responding from ACTH. So it can be all the way back to the anterior pituitary gland. That is going to cause weight loss. It can cause fatigue and weakness, hypotension, and also sometimes they have kind of a little bit of skin darkening right in their face as well. So this is showing John F. Kennedy, and you can kind of actually see the different changes that happen. In this picture, it's showing how it's going to be where he does have Addison disease, and he's being treated for it, but you can kind of see how his face looks a little bit darkened, especially on the cheeks. He looks a little bit thinner in that picture as well. He looks fatigued to me, but hey, I mean, that could be because he was president. So that would make anyone fatigued, right? So that's showing after he's given corticosteroids, that's one of the treatments. You're given oral corticosteroids. If your body's not making corticosteroids, then you are going to take it orally, and you can kind of see the change that happens from that. So now let's take a look at how this stress gland is going to come about in the stress response. So any kind of stressors that you might have in your life will elicit this thing called a stress response. So stressors, you can have good and bad stressors, right? If you think about how you're planning this wedding and you're super happy, but at the same time it's very stressful. And then of course there's the other type of not so good stressors in your life. Maybe you're taking A&P and micro at the same time, and that can be quite a bit of a stressor. Maybe you have to work full time, and you also have a family at home, and you're taking classes, and so that can be a stress as well, or grief. So let's take a look and see how the hypothalamus kind of initiates this whole response. The first kind of stage of the whole stress response is going to be something called an alarm reaction. An alarm reaction is going to be that initial response. And usually it's going to be these very quick, not immediate, but the first exposure to the stress. Let's say that you're about to take an A&P test, or really any test that you're nervous about. This alarm reaction is going to kick in because of that stress. And if you think about everything that happens when you get nervous, kind of brings us to understanding why it happens, because the key hormones that are involved are epinephrine and norepinephrine. So I know that you guys have heard of epinephrine and norepinephrine, but you have heard of them as a neurotransmitter, right? They are going to be responsible for that fight or flight response. Well, in this case, since you have an adrenal gland that is secreting it, they are going to be hormones, but they actually are going to elicit the same response. They're going to increase your blood pressure, they're going to increase your heart rate, and all of that stuff that you can remember that happens in that kind of initial nervousness response. Usually once that stressor, if it is a short-term stressor, your exam, once it's gone, once you've taken the exam, then usually your body calms down and the alarm reaction goes away. Let's take a look and see what happens when you're in kind of this chronic stress mode where your stress does not go away. It moves from the alarm reaction, which is I'm going to fight this stress. It moves to something called a stage of resistance. At this point, it's going in and saying, okay, well, the stress is here to stay. Let's try and figure out a way to live with the stress. Let's try and figure out a way to deal with this stress. So that's going to be where the cortisol is going to kick in. That's remember another stress hormone that you're going to have. Cortisol goes in and it's going to raise blood sugar levels. Remember, here's grandma coming in, making sure that you are getting plenty of food for whenever you are stressed. So it's making sure that your body can deal with this stress for long term, making sure that you have plenty of food for your cells so your body can live for quite a while after that. It needs to make sure that your body has enough sugar to meet your energy demands. If this is something that lasts for weeks or months, maybe starvation or again, chronic stress, anything like that, then it goes through your glycogen stores, and then it kind of moves to this stage of exhaustion. Once your fat stores are depleted, it goes to breaking down proteins, which is not good at all for your body. So your body is basically going in and breaking down proteins. Again, it's trying to help you survive. It's trying to make sure that you're meeting your energy demands to help your body survive, to make sure that your body can breathe when it needs to make sure that you can move, muscles when you need to. Anything that your body needs to for energy, which is basically anything, right? Stage of exhaustion is going to be where your proteins are breaking down and you're weakening. You are more susceptible to illnesses as well whenever you're under this chronic stress, when you get to this kind of stage of exhaustion. Because remember, one of the things that we talked about with cortisol is how your body, it kind of suppresses your immune system. So if you've kind of been stressed for a long time and if you feel like you're getting sick a lot, you probably are getting sick a lot because your body is in this kind of stress response. This will continue until, of course, the body is no longer alive anymore at that point. So that's the the beauty of your stress response, right? So try and find ways to help your body deal with stress. All right, so the next video that we're going to be taking a look at, the next section, is going to be looking at the pancreas. So until then.